Turning now to the troubling rise in norovirus cases. Data from the CDC shows cases of the contagious virus are rising in several states across the country. Joining us now is Dr. Suhail Salem, a gastroenterologist with Dignity Health Northridge Hospital. Thank you so much for being here.
Thank you so much for having me, Kathy.
Can we start with exactly what is norovirus?
Norovirus is the leading cause of viral gastroenteritis in the United States. It is highly transmissible. You come into contact with it through contaminated food, water, contaminated surfaces, or person-to-person contact. And one of the reasons why it is so highly contagious is that it only takes a small number of viral particles, as few as 18 or less than what would fit on the pin of a needle, to become infected. It's highly resilient in our environment, so it can live on surfaces despite freezing temperatures, despite temperatures up to 140 degrees Fahrenheit, and a lot of disinfectants, which are alcohol-based, won't get rid of it. So it's incredibly resilient. It only takes a little bit to get infected, and it peaks in the wintertime. So that's kind of why we're seeing it rise now.
So what are some of the symptoms, and how long should you expect them to last if you have norovirus?
Well, symptoms usually include watery diarrhea, nausea, vomiting, abdominal pain. They usually begin within 12 to 48 hours of contact with the virus and last for up to 2 to 3 days, although for some individuals it can last longer. Get sick, sometimes the virus can still linger in the stool for up to several weeks afterwards, so it's important to maintain good hygiene even after you recover.
How do you know when you need to see the doctor if you have some of those symptoms, because those symptoms can apply to other things as well?
Well, that's a good question. I mean, for most people, you can manage this disease at home by maintaining good hydration, drink lots of electrolytes, take symptomatic treatments. However, for certain individuals who are more vulnerable to the virus, especially elderly, children, or immunocompromised individuals, those would probably be the ones that might need to see the doctor more urgently.
And how can you compare this to, say, the flu? We're all familiar with flu and flu symptoms. How would it compare?
Well, the flu is really different symptoms. So the influenza virus will cause more so runny nose, cough, high fevers, muscle aches, things like that. Whereas this is really going to be more of what we call a stomach flu with abdominal cramps and watery diarrhea. And often it comes after eating something that might have been contaminated.
Okay, I think we can all agree neither one sounds pleasant. So like you said, practice good hygiene. Thank you, Dr. Salem, so much.
Thank you so much.